we've turned these conversations into really just short vignettes to hear about really cool stuff that's going on in the midst of this health crisis and COVID crisis and economic crisis. But really just want to hear, what you guys are doing. We've seen some really good things online about the way you've pivoted and put new resources to trying to fix parts of this problem, and really just want to spend 5 or 6 minutes just hearing about the things you guys are working on. So I'll toss to you, if you don't mind, do an introduction of yourself, also your role and the team, and then just kind of tell me the things you guys have been working on the last few weeks.
Cool. All right. Well, thanks for that. So my name is Tom Wavering. I'm the Executive Director of the Tom Love Innovation Hub at the University of Oklahoma. And our mission is to increase innovation and entrepreneurship at the university, but also across the state. And we do it through amazing resources and programs, and especially at times like these with everything with COVID, that's even more important. And so we continue to do a lot of virtual programs and things to help businesses. But one of the other things we've started doing, which has been really exciting, is, we have physical resources and maker spaces and things like that. But we're just part of the resources the University of Oklahoma has, and especially the Health Sciences Center has. And so pretty early on in the spread of the pandemic, across the area and across the country, both the Vice President of Research and Partnerships at the Norman campus, Tomas Diaz de la Rubia, as well as the Vice President of Research at the Health Sciences Center, Jim Tomasek, kind of came together and said, hey, as a university and all of our labs and all of our facilities and everything, how can we help? And we were seeing a lot with regard to shortages for personal protective equipment, questions about things like ventilators, other types of masks or devices. And there was a lot on social media like, oh, make this at home, make that thing at home. And we thought, well, what if there was a way that we could use the resources of the university to really help kind of vet and make and design some of these things that were critically needed. And so from Tomas Diaz de la Rubia and Jim Tomasek, they signed me and Dr. Yakub Alsaka from OUHSC as the leads of what we call our University of Oklahoma COVID-19 Essential Equipment Task Force. And this is an effort of about 40 scientists, researchers, students, staff across both campuses and almost every college, who all have unique expertise to kind of help. And what we're really trying to do is bring in the three real key kind of communities. So there's kind of the maker, engineer, innovator community who wants to make stuff. There's the doctors and nurses who need stuff. And then there's like occupational health and safety folks who want to make sure in this whole process, nobody really gets hurt.
Right.
And you really need all three of those people at the table as you're trying to embark on an adventure like this. And so we were fortunate that at the Health Sciences Center, they have both a very strong clinical program, but they also have a very strong occupational health and safety program. They actually do a lot of certifications and training for people at the state level. And so what we've done is create this kind of cycle where we can kind of take designs either our team comes up with or we see on social media or other places, try them out, make them, prototype them. Then we can hand them over to occupational health and safety people to test and say, does it really work the way it's supposed to? We can hand it over to doctors and nurses and say, will you actually use it? Is it comfortable? Does it function the way you expect? And then we can go through that process. And then our goal for everything is to either publish it to a website. So we've set up a website, ou.edu/4Oklahoma, where everything, all the designs and data and everything is at that site. And then for some things which are a little bit more complicated, that you can't maybe just make at home and then use, there we're actually partnering with local Oklahoma manufacturers to take the designs we've made and validated and scale them up and help distribute them out to the folks that need it.
That's fantastic. So I guess two central questions. One is, how did you guys decide which space you were ultimately going to play in? Because I know there's a myriad of options, I think, that were out there for you guys to decide on, especially with your expertise.
Mm-hmm.
And then the follow-up question is, how did you herd all the cats? Knowing 40 really bright and talented people, how did you keep everybody kind of moving in the same direction?
Sure. Well, in times of crisis, it's pretty easy to keep everyone on target because there's a very clear and ever present, danger and focus that you're working towards. So the latter part, I would say, we have amazing folks, across the university who all kind of recognize the challenge of this current situation, and basically everyone's putting ego and initiative and everything aside to say, hey, how do we help, and how do we make a difference? And the other, and so you asked about kind of how we decided, and it really was looking at a combination of national headlines, state headlines, and then local feedback where we were hearing, N95 respirators, there's a shortage, or testing swabs, there's a shortage, or face shields, there's a shortage, or ventilators, there's a shortage, right? So you'd hear about this stuff. And then a lot of times along with it, you'd find people who then said, I have, make your own fabric mask, make your own 3D printed respirator, make your own, this, that, or the other thing. And so what we tried to do is wherever there seemed to be a concentrated, a level of attention, both in terms of the need and people trying to come up with solutions, that's where we started at first. The other thing we considered is, the FDA at this point has some very they're ever evolving regulations with what can be used and where. So we also strategically tried to pick things that had less FDA concerns up front so that we could kind of design that and develop that and get that out. And then other things that require a little bit more. Again, the FDA is being great in terms of really trying to be amazingly aggressive for a federal institution focused on what they normally do. They're working very quickly, but those are just always take a little bit longer. And so those are kind of the things that are coming on next. So our initial effort was focused on face shields because that seemed like an easy thing to do. It seemed like it was relatively needed. So we came up with a couple of designs in partnership with OUHSC, and we've been printing those and manufacturing those and delivering them to a number of different groups in the area. And those designs are on the website. Some of the things that we just actually published this week is a respirator mask. So with the shortage of N95s, we've been able to develop Ken Merrill, who is an architecture professor, actually came up with this design for a mask that fits the face really well, allows people to breathe, can use any number of different types of commonly available materials as the filter, and it actually works as well as an N95 mask. And you can make it all at home and do it yourself. So that was really exciting. And now we're working with some manufacturers to do that. And I would say some of the next big things we're working on that we should be published next week is we've been evaluating different ways to sanitize N95 masks. So maybe you're a small clinic or doctor's office and you have masks and you're not able to get more and you'd like to be able to reuse them. What is a way you could reuse them safely? So we have a couple of technologies and solutions we're developing there. And then we continue to look at ventilators and swabs. And right now, one of the big things as Oklahoma is getting ready to get back to work, what are other types of protective devices? So, you go to some grocery stores and they have the plexiglass shields up, and things to kind of physically separate people who are going to stores or doctors' offices or researchers or whatever. And so we're actually in the process of manufacturing a number of those too.
That's awesome. So I guess one final question is, if somebody wants to connect with you and be part of your conversation, how do they connect with you guys? How do they find you guys? Or more importantly, how do they just find out more about the story that you were just telling me about the cool things you guys have done?
Sure. So to learn more about all the work we're doing to help fight COVID-19, just visit ou.edu/4Oklahoma. We have the designs are there, information's there, as well as different like Google Forms where if you're, say, a maker and you want to help, where you can give information. Maybe you're a hospital and you need help, you can give some information. We also have a number of helpful links for folks like OU Medicine who have their Million Masks campaign. We link to that as well as some of the other local groups that are doing things so that hopefully the website can be kind of a one-stop shop for folks who want to help and folks who need help.
It's fantastic. Well, I mean, thank you to really the broader team, all the people that are leaning in on this conversation right now. It's great to have a partner like OU thinking about thought leadership, but also actionable work. Just thank you for being such a good community partner. Maybe one more time, give us the email or the website one more time, if you don't mind.
Sure. So the website with all the information about our work around COVID-19 is ou.edu/4Oklahoma.
And is that number 4?
FOR.
FOR. Okay, cool.
FOR, Oklahoma. Because all the work we're doing is for Oklahoma.
Nice. Well, I'll throw you a boomer sooner to say thanks.
All right.
Thanks, Tom.
All right. Thanks a lot. Stay safe.
You too.
All right. Take care.
Bye.